Welcome everyone to this webinar, Integrating an Online Treatment Program in the Management of Chronic Pain in Primary Care. I'd like to start the meeting by acknowledging the traditional custodians of country throughout Western New South Wales and their connection to land, water and community. I pay respect to elders past, present, future, and extend that respect and a warm welcome to all Aboriginal and Torres Strait Islanders online tonight. Thank you all for joining us. Just quickly, some housekeeping. If any questions, if you could put in the chat box. Everyone's on mute tonight. We are recording the session, so that will be on the website later for you to view, and we can share the link with people that couldn't make it tonight. If you're viewing on a shared device, you can put your name in the chat so we can attend, or we can record your attendance. There's also an evaluation at the end of the presentation. If you don't mind just completing that, we would be grateful. I'd like to introduce to you Dr. Jane Wheatley and Katie Dobinson. Dr. Jane Wheatley is clinical and health psychologist at the Department of Pain Medicine, St. Vincent's Hospital. She has more than 12 years experience in assisting people with improved management of chronic pain conditions. Prior to her role with St. Vincent's Hospital, she worked with both St. George and Gosford Hospitals chronic pain services. In her current role, Jane has most recently been involved in the development of the Tele-Reboot, a group pain management program that integrates This Way Up's online chronic pain program via telehealth. In her previous role with St. George Hospital, she worked on the design and development of the psychological components of the Energised Moderate Intensity Pain Management Program. Jane completed her doctorate in clinical and health psychology at the University of Newcastle in 2012. Katie Dobinson, who's also with us tonight, is a clinical psychologist based at the Clinical Research Unit for Anxiety and Depression and This Way Up at St. Vincent's Hospital. In this role, she provides cognitive behaviour therapy to adults presenting with a range of anxiety disorders and comorbid depressive symptoms. In addition to supporting consumers and clinicians integrating digital mental health into their practice using This Way Up's digital interventions, Katie also works 1 day a week in a private practice. So I'd like to thank Jane and Katie for joining us tonight. Jane, I'll hand over to you if you'd like to start sharing. Thank you.
Thank you so much. Okay, as mentioned, I'm going to be talking about integrating an online treatment program in the management of chronic pain in primary care. Ali did a wonderful acknowledgement of country, so thank you very much. So we're going to be looking at the impact of chronic pain, some of the challenges that you might have noticed in managing chronic pain in primary care, look at some of the evidence-based approaches to chronic pain treatment, and then looking specifically at This Way Up's online chronic pain treatment program. I'm also going to talk a little bit about the types of patients or things to look out for in patients when you're deciding whether or not This Way Up might be a good option, and also how to support engaging those patients in treatment. We'll then look specifically at how we actually prescribe, navigate This Way Up in order to best help patients. And finally, we're going to look at some of the other programs available via This Way Up and how they can actually help patients with persistent pain as well.
Sorry to jump in, Jane.
Yeah, you're
Sorry
right.
to interrupt you.
Yep.
I just wanted to let you know what I can see. I'm not sure if it's the same for others, but it's the view that's got the next slide on it as well. If you just switch displays, I think.
Yeah,
maybe.
Sure. That was what I was worried about happening, so thank you. Is it now the correct one?
Yeah.
Okay,
yeah.
Beautiful. Okay, so just looking at the impact of chronic pain, so there were quite a few things that came out of a recent, 2024, so this year, Chronic Pain Australia national survey. They looked at what was going on for patients with chronic pain. Now, the most common type of pain suffered by the people that responded to the survey were back pain, widespread pain, which includes things like fibromyalgia, and nerve pain. Now, when it came to the impact of chronic pain on people's lives, most people, so 7 out of 10 people, reported decreases in their activity levels, which of course then has a knock-on effect on pain and on our overall health. We know these days how much a sedentary lifestyle is really not great in terms of the impact on potentially developing a lot of other health issues. 8 out of 10 reported that they were experiencing significant mental health issues. 90% of the people that were surveyed also described sleep disturbance. And we know that that's a really common factor when it comes to persistent pain, is problems with sleep, not just because of pain, but also sometimes because of the associated problems that come with having pain as well. The big impact in terms of society was also around the fact that, nearly half of those with chronic pain are in their prime earning years. So it means that that has an impact on national productivity. A lot of people in this particular survey had to stop working because of pain. In fact, it was almost half. And 30% had been limiting their working hours. So this also results in patients deprioritizing other healthcare because of additional financial strains. So, trying to cover the cost of things like pain medications and treatment were the things that then took priority in terms of health. And in terms of activity, anecdotally, our rural patients tend to also push through in terms of their pain more, just trying to actually continue to work, which actually can then make their pain worse, given that, that their livelihoods can be quite dependent on them just continuing to push through. The other areas of problem were around things like relationships. So 2/3 of the people that responded felt like that their pain was putting strains on family relationships. Around 60% reported that they had reduced intimacy with their partners, and about 4 in 10 were struggling with children to pick up, play with them, that sort of thing. So, and we know that there are a lot of factors that can impact on the pain experience. So that's your pain intensity, frequency, disability, including all of those biopsychosocial factors. So sleep, relationships, financial stress. So, it's that bit of a feedback loop that can then happen. So we know there are certain patients that are at risk of poorer outcomes when it comes to managing their pain. Now, those patients who are at poorer risk, we've got some of the factors there, the biomedical, the psychological, and the social. Those are actually patients that do require closer follow-up, but are also in need of a greater emphasis on multimodal approaches to treatment. So with both pharmacological and the non-pharmacological approaches, but they also tend to be those patients who are more distressed, have greater difficulties accessing services, and treatment can often be largely medically focused. A lot of times because of that patient distress and noted difficulties, it tends to be, well, this is seems to be the easiest option or the only option that we've got. So that can be quite problematic. So pain is one of the most common reason for clinical encounters in primary care, as you would know. And the complex nature of chronic pain syndromes can make assessment and management quite daunting. So the literature shows that GPs tend to have a low satisfaction in treating patients with chronic pain. There was one study that found that it was only around 34% of primary care doctors felt really comfortable in managing these patients. One of the studies that was done recently looked at what GPs found were the things that were most difficult in managing these patients. And the first one was around those, patient education and expectations. So it could be quite difficult to convince patients to engage with holistic pain management strategies. And low literacy rates, health literacy rates, we know are associated with poorer outcomes. So, you know, it's also really difficult when you've got patients with then unrealistic expectations around, you know, what medical professionals and what, you know, the medical system should be able to do to help with their pain. So that's another area that that GPs identified as being quite difficult. Addiction and compliance. So, you know, we've all heard a lot about the opioid epidemic. I'm sure by now lots of people know about, you know, Purdue Pharmaceuticals and all of that sort of thing. But of course, you know, down at the treatment level, you know, it still can be difficult with managing some of these patients who are already opioid dependent. Preventing, you know, some patients from increased tolerance and increasing their dosages because they're finding that, you know, what they're on is not working anymore. And also, you know, making sure that patients are complying with treatments. In terms of effective strategies, it's another challenge is, you know, how do we choose the right medication? You know, how do we manage those interactions with those medications with patients with comorbidities? And a lot of, you know, our chronic pain patients do have other conditions that they're also dealing with. So trying to find that right, you know, treatment plan, doctors are finding quite difficult. Patient distress is another area that has been identified as a considerable issue. You know, nobody wants their patients to be, you know, upset, distressed, and, you know, we do just want to help, but that can actually then be a real challenge in actually getting the right treatment happening. You know, lots of us, you know, we kind of want that magic wand. You know, we want the quick fix. You know, and we get these strong media messages around, you know, painkillers and, you know, this new miracle treatment, which if it's, you know, on one of the current affairs shows, it's usually just another form of a TENS machine. But these things can actually lead our patients to be even more distressed because, of course, you know, they're thinking, well, why haven't I been given that magic cure? My pain is, you know, severe, it's limiting me, and I just want the thing to fix it. Unfortunately, with chronic pain, of course, there's no real simple, you know, algorithms for managing it. And so that can be then quite problematic. The other thing, of course, that is difficult is, you know, that access to multidisciplinary services, which is one of the reasons for giving this talk today, because, you know, by involving an online program, it can be a way to incorporate some of that multidisciplinary treatment in a slightly different way. So, of course, this is really important in terms of, you know, trying to manage people's pain better because, you know, primary care professionals are, you know, the people who are at the coalface of dealing with chronic pain. So GPs are usually the person that is turned to first when it comes to treatment. And you know, there's been a big increase in GP visits for chronic pain in the last few years. As you can see, 67% in the 10 years to 2016. And GPs are the ones that patients say that they trust most when it comes to dealing with their pain and, you know, believing what their GPs say. So what do we need to do then when, you know, patients actually come in and, you know, see somebody for chronic pain? I'm sure all of the GPs here are very aware of this idea behind the assessment and treatment plan, but I'll quickly go over it. So what we'd be looking at is a baseline assessment, which, you know, can be difficult when, you know, GPs have very limited time and may need to be done over more than one visit. When people come and see a chronic pain service, you know, we can take, you know, anything from 1 to 3 hours to do, you know, our full assessment with the full team. So as you can imagine, you know, we have a lot more time to really delve into a lot of different areas that we know impact on people's chronic pain. The ACI and their chronic pain website have actually got a really nice quick steps, which I've linked there, a quick steps plan to actually go through and try and get some of the information that's really important in terms of, you know, trying to understand what some of those factors are in a nice, simple way so that patients can start to also get that understanding of what's happening for themselves. So we'd be looking at things like, you know, whether or not there's any red flags that we need to be concerned about. You know, what's the level of psychological distress for that patient? Is the patient actively already engaged in some self-management? Are their medications effective in managing pain and improving function? And within that, looking at what the patient's expectations are around pain medications. It's actually really quite important, because some patients have the idea that, you know, with painkillers, I absolutely hate that term, that, you know, it's meant to completely get rid of their pain, whereas actually what we're looking at is trying to decrease discomfort to the point where the patient can actually start to, you know, re-engage in activities, start to improve their function, start to be able to get on with things, because it is that balancing act, isn't it, between, you know, you're wanting a patient to be able to function and do things. You know, you don't want to be giving them so much medication that actually, yes, they might not have any pain, but they actually can't function. So it's getting that balance right. Looking at whether there are any indicators of medication risks, looking at whether or not the patient is still engaging in some of the key physical activities, or have they started to change? Are they starting to do less in terms of work, walking, standing, that sort of thing? Looking at their sleep, and also looking at things like nutrition. Can we improve there as well? This can be, you know, it can be really validating for the patient that, you know, we are looking at all those different areas that can be impacted, because quite a lot of times patients will say that they've started to distrust, you know, that the medical system is listening to them, that they actually understand how complicated it is for people. So that can be quite validating for people, and it's actually a really good start then in terms of them wanting to engage in treatment as an active participant. So in terms of then treatment, we tend to say, well, look, you know, it really should be approached from a biopsychosocial perspective, looking at all of those different factors, because if you are just aiming at, you know, one treatment option like medication, and there are so many factors involved in the pain experience, you're then trying to medicate all of those things true. You know, you might be trying to medicate, you know, somebody's financial stress, their distress at dealing with relationships, their worries about moving and causing themselves injury. And of course, you know, that's not going to work very well. Plus, if their medications, you know, stop being as effective over time, if they don't have any other strategies or ways of managing or ways of adapting and changing what they do, they get a bit stuck. So, you know, what we sort of say is, well, look, the evidence says that a self-management approach is best, because you're looking at fostering health literacy. You're looking at that pain education, which is tailored to the patient's level. You know, what information do they need, and learning what strategies can actually be helpful for them. Once again, it's also, you know, taking that multimodal approach. So we're looking at, yep, you know, medications can actually be an important part of a person's treatment, but also we've got to be looking at the non-pharmacological interventions as well. And in that way, you're actually also looking at coming up with an individualized plan that fits for that patient, their background, their willingness to engage. So it is actually then something that they're more likely to engage with if it fits with how they, you know, can function. In terms of opioids, you know, the evidence suggests that, you know, if they're indicated, we start with the idea that we're going to be stopping. So looking at a deprescribing plan at the point of initiating, deprescribing where there's a lack of clinically meaningful effect on a person's function. and also looking at deprescribing over time for those individuals with a high risk of harm from opioid use. In terms of patient expectations, we mentioned before that that can be quite difficult. Managing those expectations around, you know, we might not be able to cure your pain, get rid of your pain, but actually this is about you being able to do things in spite of pain, manage better in spite of pain, and hopefully have your pain change over time as you learn more skills to manage a little bit differently. We often hear things from patients like, oh, I've tried exercise, but it made my pain worse. You know, if I move, I'll re-injure myself. So there's also the opportunity there for us to be able to, you know, talk to patients around, you know, likelihood of re-injury, looking at, you know, if you tried exercise, you know, was it the right exercise? Was it too much, you know, or was it, you know, that you started and really overdid it and the system then responded? So there's then that opportunity to actually help people to be more willing to try some more strategies. So that self-management approach is kind of one of the most important aspects of a patient's chronic pain management plan. So we know that those patients with chronic pain, if they've got low health literacy, there tends to be associations with increased pain severity, pain catastrophizing, and more depression. And in terms of low back pain specifically, there's also that kinesiophobia or fear of movement that tends to happen. So we really do then need to take a person-centered approach for self-management. So, which, you know, involves helping the patient to have, you know, more knowledge and understanding by pointing them in the right direction in terms of education, by introducing them to that biopsychosocial approach, so that they can then be involved in shared decision making around, well, you know, what can we do to try and improve your pain, improve your function? What can you do? What can the doctor do? What's reasonable? It starts to then create that, you know, that view for the patient where it's like, oh, well, I can actually do some things that are helpful for myself. You know, I can take charge of these things. These are the things I can't take charge of. And so you get a better outcome. So in terms of then, you know, this the biopsychosocial approach, overemphasis on passive biomedical treatment, we know that that actually undermines patient engagement with the more active approaches. So it's really important to actually, you know, from the get-go, talk to patients around taking that whole person approach, that we're looking at all of those different elements that actually, you know, contribute to change in our pain, change in our function, and, you know, looking at weighing up all of those areas that we might be able to make some changes in and helping patients to figure out where to start. In terms of actually then taking that approach, you know, we're human beings. We tend to, you know, go through patterns and do the same things that we always did. So making changes is not easy. And what we are asking people to do is change their usual behavior, change their ways of thinking about, you know, how they're managing their pain, which can be really difficult, you know, because we know, you know, making the decision to make a change, you know, can be hard. And then also forming those habits take time. So this is where having some additional support can be quite helpful. And it's also where then having something like an online program can be quite useful. So in terms of, you know, what we offer in terms of our online pain program by This Way Up, it was a collaboration between the Department of Pain Medicine at St Vincent's and also the Clinical Research Unit for Anxiety and Depression. So originally it was called Reboot Online, which is why you'll see that dotted throughout some of these slides. And it is self-management using a multidisciplinary approach. So given that we know that a lot of rural and regional areas have a lot more difficulties in accessing multidisciplinary services, And in fact, in most of Australia, most people don't have easy access to multidisciplinary services. So this is one way that we can utilise what resources we do have and then add this additional complement to having some more multidisciplinary input. And this was one of the quotes from somebody who did some of the online programs. So we know, and we know from feedback that we've gotten from quite a lot of our rural and regional patients that they've actually found it really helpful to be able to access, a program, even though, they might not be able to come in and see somebody in person. So self-management programs like the This Way Up program look at both patient education and also, coming from usually a cognitive behavioural perspective. So they're widely recommended. In terms of managing chronic pain, CBT-based group programs are in fact the gold standard. So CBT-based programs are the most studied. It's been found that these sorts of programs help to reduce pain, enhance physical function, and increase patients' self-confidence in managing their pain. So in terms of the This Way Up online pain program, this is what it actually has. It's an 8-lesson program over 16 weeks. One of the unique aspects of the This Way Up program is with the, taking it from a multidisciplinary perspective, they've got the relaxation station, which has audios of, various types of relaxation that patients can use, as well as, looking more from a physical perspective at movement. They've got the movement station, which has 46, I think, videos of exercises, as well as Tai Chi. So most other online pain management programs that you might encounter, they have some components. They'll usually have some pain education. They might have goal setting and looking at pacing, but they don't usually have specific exercise programs, relaxation programs, and things that people can use. So that's quite unique to the This Way Up program. So they do like to tout that it was the first multidisciplinary online pain program, which is wonderful. So in developing the program, a lot of consultation was done with various different specialists in lots of different areas, including the allied health guys, so physiotherapy, clinical psychology, occupational therapy, and dietetics. And in the program, there are actually videos from some of those specialists talking about specific aspects of pain management. It covers, in terms of physiotherapy, looking at a graded exercise program. So in addition to looking at how you would pace your activity to manage pain, it also talks about how you would pace your exercise in order to improve your pain. So like I said before, a lot of times people have tried exercise before, found that it actually flared up their pain, and so they've become quite fearful of doing exercise. So this program actually then looks at how you can pace your way back into exercise at a level that's comfortable for you, and also increasing slowly to improve function over time without flaring up pain, but instead slowly allowing people to get back to doing activities with either the same level of pain that they're managing with at the moment or a decrease in pain, which is usually what we would see. In terms of psychological aspects, the program looks at thought challenging, how to manage your activities and plan them out, how to problem solve difficulties that you might have in terms of things you might have stopped doing because of your pain, or activities you might have had trouble getting involved in, or communication with family that might have been difficult, new ways of working those things out, with your pain, while actually hopefully improving your quality of life. And finally, flare-up management is a really important part of learning about pain management as well, because inevitably, we're going to have pain flare-ups from time to time, especially while people are trying to learn how to manage their pain differently. They're not always going to get it exactly right. That's also where primary care can be quite helpful in helping patients to, not panic when they overdo things or, flare up their pain, and understanding that that can be part of learning what sort of things, trigger increased pain, what sort of things happen in the lead up to a flare up in pain. Are you having more stress, not looking after yourself as well in terms of activity, having more family conflicts that then actually start to wind up the system and result in a flare up. So in terms of the program, these are the areas that it covers in terms of educating people about pain and about all of those aspects and things that can affect it. I'm not going to obviously read through the list. And we also look at then strategies. So it's not just information, it's information plus it's then the active components that can help people to start to make some changes. And this is a few stills from parts of the program. So the pain program uses the story of Martha. All of the This Way Up programs tend to use different, different patients, different backgrounds, different stories. But this follows Martha and her journey through pain as she meets and works with the different members of the multidisciplinary team. Now, in terms of, whether or not it's worth doing an online pain program as a component of a patient's treatment plan, there have been quite a few studies into the pain program online, or Reboot Online as it was known. And these two in particular, the first one was looking at the feasibility, acceptability, and outcomes of the program. And they found that there were improvements on pain interference and intensity, pain self-efficacy, decreases in things like catastrophizing, increased pain acceptance, and also there were smaller effects, but still they were still a moderate effect size in terms of decreased fear of movement and improvements in depression, anxiety, and stress. So it was found to be that from that first study that the program was feasible, well accepted by the participants that engaged in it, and they were recruited from remote, rural and metropolitan areas throughout Australia. So the second study was a randomised control trial, which also looked at improvements in the intervention group, and found similar results, that people had improvements on self-efficacy, decreased fear of movement, and improvements on their pain overall and function. So now, often patients have difficulty getting started with pain management programs or really staying engaged. So it's actually important to do a few things. One of them is actually, having a chat with the patient around, how they're feeling about your understanding of their pain, their concerns around their pain, and what they think's going on. Because, if patients are really biomedically focused, but feel like that you're just going to say, oh, go and do this online pain program, they can feel really invalidated and like you're saying it's all in my head, would be the common thing that you might hear. Where actually, if they feel like that, you understand what they understand about their pain and what's going on, and you can also then add in a few additional, pieces of information if they're missing some information, that connection and empathy can actually support the therapeutic alliance, which means that then patients feel like they're understood, and they're more likely to then want to move into, some different options where they're actually, they feel like it's okay for them to learn a little bit more, for them to do a few things that are a little bit different. So one of the things that's important in that regard is looking at targeted reassurance, that anything, red flag conditions have been excluded, it's safe to start to do some activities, but also that we understand that, something has happened. They might not have the initial injury anymore because, of course, things heal up as well as they can over time, but that there have been changes in their system, and that, we understand that, but that there are some things that we can do ourselves, and there are some things that, medical staff can do as well as a part of our whole program. So the reason I've got the little car there is because, it can be really useful to actually have a bit of an analogy for patients to sort of help them to understand, why we might want them to do some things for themselves. So for example, with this lovely little car, do we just take the car to the mechanic only when something goes wrong and do nothing else for the car the entire time? Well, no, we have to actually take care of the car in between trips to the mechanic to fix issues. We still need to check the oil, check the water, we might need to top it up from time to time, check the tyre pressure. We don't just let the tyres go flat. We get it serviced. We pay attention to any dashboard indicators when they pop up, to see whether it's a problem with, say the engine, or is it a problem with the dashboard indicator light. But it's important that we manage that, or else, things are going to fall apart. So it's the same with our health. It's the same with our pain. We can't just rely on one strategy of waiting till things go wrong, or just relying on the once a year, medical appointment. We actually have to, contribute to our own health and well-being. It can sometimes be useful to actually use a bit of an absurd example to try and get patients to understand why they might want to take ownership of some of their health. So a bit of an absurd example. Let's say one of my family members was really getting frustrated about not losing weight, and when asked about it, he said, "Oh, but I've cut out butter," and expecting that one change was going to make a huge difference. But yet there are lots of factors that are influencing that person's, weight and not losing weight. So, using little examples can actually be quite helpful for really helping patients to understand them, why they might make a self-management approach or make a change. So we really do need to actually check in and see where our patient is at in regards to that. So some patients, are not really, they're still in a pre-contemplative phase, while others have moved on to contemplation and preparing themselves. They actually do want something different. They're a bit tired of the way that things have been going. They're tired of, their medications being in control of their pain, and they're actually looking to do something a little bit different. So it can be really helpful to try and get a sense of where your patient's at before prescribing the course. And if they aren't ready, to make some changes, there's a lower chance of success. But it does give us the opportunity to try and increase motivation, start to set some expectations. I put a couple of little links down there of some infographics that I actually think are quite helpful for starting to get patients to understand all of the things that can lead up to, sort of a worsening pain picture, and therefore think about some of the things that they might be able to do to make some changes. We also want to look at, is this patient somebody who's got the capacity to make a change? So any pain management program kind of requires us to make some changes to our behavior, make some cognitive adjustments. So we have to have a bit of, flexibility in our ways of thinking, and openness to trying some things differently or thinking a little bit differently. So if patients aren't willing or don't seem like that they are able to see things from a slightly different perspective or be willing to try things a little bit differently, then they might struggle with this program, and you might look at perhaps getting them to do some more behavioural type interventions first. So you might get them to, perhaps engage, say with physiotherapy, to, do some paced movement with a physiotherapist, and, get them to reflect and see how things are going in terms of their function and look at it from that perspective to start off with. You also want to think about, setting up expectations with the patient, have the conversation around what's involved in the program, the time commitment, talk to them about the model of chronic pain and how self-management can be helpful. From a practical standpoint, you also need to make sure that there's somebody that can use the technology. Do they have access to the internet? Can they navigate online material? It's quite a different way of learning, different from face-to-face. And for some people, they find that a little bit too challenging. But it might not be something that they can't do. It might be that, we have to do a little bit of brainstorming to try and figure out ways that they can perhaps do it, at a family member's house, or, would they be able to check in with a friend, on using the technology. And finally, we need to think about how a self-management program online would fit with that patient's overall pain management plan. What else have you got in mind in terms of that biopsychosocial approach? And does that fit in with their plan at this time? Now, I mentioned before around, lots of people have tried exercise and said, oh, it made my pain worse. They did, one of the studies that they did on the online pain program, they looked at the real world adherence to the program, as opposed to our lovely, neat scientific studies that can happen. And what they found was that people did make improvements, but adherence was impacted by things like fear avoidance. So, those patients who are really quite fearful of movement or re-injuring themselves with movement, were a lot less likely to adhere to the program. So it doesn't mean that those patients shouldn't do an online pain program. What it might mean that is, in terms of your plan for that patient in terms of their treatment, they may need some additional support. What we're trying at the moment with several of our patients in the pain service is for those patients that the best option for them at the moment is the online pain program. We're actually also getting them to come in and see a physiotherapist, I think it's once a week at the moment for a period of time, to actually support them a little bit more with the movement aspect of the program, to see whether or not they become less fearful with that additional face-to-face support. So you might be able to do something similar. If you've got a physiotherapist or another movement professional nearby that can provide that little bit of additional support around movement, you might then have a better overall outcome for that patient. Additionally, there was another study where we looked at providing a bit of additional telephone support in addition to the patients doing the online pain management program. And what they found was that by contacting the patient prior to starting the program, checking whether they'd enrolled, how they were going, and then towards the end, how they were going in terms of getting closer to completion. We found that actually those participants who had been given that additional support, they were more likely to actually go ahead and enroll. So we'd prescribe it, and then of course people can choose to enroll or not enroll. People were more likely to enroll, start it and then complete it, versus those who were just prescribed it as usual. Now, in terms of the outcomes, the people who completed it, it didn't actually matter whether you were in the telephone support group or the individual group, but it did mean, that if you were in the telephone group, you were one of the people that was more likely to actually get going. So I guess what it's saying here is that, supporting your patient to actually get started can be really important and help them be more likely to engage in treatment. It's also really useful just in terms of, checking in that your patient is getting a good understanding of what's happening, that they are actually, starting to make some changes, and so that can be helpful as part of their overall plan. So there are, the online pain program is not the only one available through This Way Up, but there are other options in terms of, treatments, online treatment that can be used. So MindSpot is one of those other programs. It doesn't have the same movement component, but it does have the CBT component in terms of, pacing, pain education, all of those sorts of things. Now, if your patient is not quite ready yet for a pain management program, they still might be in that pre-contemplative phase. This is where the ACI's pain management website can be quite useful. It's got lots of patient education videos and resources. The good thing about that particular website is there's lots of patient experience videos where the patients are talking about some of the things that they've noticed with their pain. And also then, if we're looking at management, some of the things that they've found quite helpful in managing their pain and why it's worth taking a self-management approach. The last one on my list there is Retrain Pain. I really like that website because it's got lots of analogies to help people to understand their pain a little bit better. And the little education slides that it has, it's basically little 1-minute lessons that cover, small aspects of people's pain experience and also management. So, if you've got a patient, for example, that is having trouble understanding, chronic pain, there's a little 1-minute lesson that helps give them that introductory idea, so that then, it doesn't take very long. You do it with the patient to then help them, to see where they're at, to see whether or not they're open to that idea. It's got areas on sleep and other things that are impacted. That just keeps it really nice and simple. And so it's a nice way to help people move towards wanting to then do more to self-manage. Now, one of the things to consider when it comes to pain management is whether or not, pain is one of the central factors that then is impacting on other things, or are there actually other more significant drivers of distress at the time that can be contributing to the person's pain picture? So, for example, if a patient is dealing with, say, post-traumatic stress, and that is actually the dominant set of symptoms that are then also contributing to their pain, but it tends to be that you'll notice they're talking a lot more about those symptoms rather than the pain. It might be worthwhile prescribing patients to a different treatment program rather than the pain management program. But just, all you really need to do in that case is do a little bit of education around how that relates to their pain. Look, this might be really worthwhile getting some treatment in this area because we know that, increased, let's say with depression, when our mood is lower, our system is more heightened in terms of, danger messages, so we're more likely to experience more pain. So if we manage our depression, it's also going to have an impact on our pain. And therefore, that person might be more willing to engage with then some treatment in that area if it's going to also assist with their pain. So now, if you are interested in your patients doing the online pain management program, you guys can actually set yourselves up as clinicians who prescribe the program. You can see there that there on the website, there is a button for clinicians, which you then click, and it takes you to this particular site, which then allows you to sign up to prescribe the programs. And you would then put in your details to register as a clinician. And then, once you've logged in and you're a prescriber, you can then prescribe the different programs that are available through this way up. So it's not just the pain program. You're able to prescribe other programs, which we quite often do at our service if something else is more appropriate. And you can see that it's quite straightforward. You put in the patient's name, the patient's email, select the particular program. Fees can be waived if there's, particular financial hardship. I'm sure Katie actually has more information about that. But that can be done under certain circumstances because, of course, everybody's circumstances are different. And, sometimes that is a big barrier to being able to engage in treatment. So, it's good that there's that option there. So, like I said, there are lots of programs that you can prescribe depending on what's most appropriate as part of your patient's treatment plan. Now, once you've prescribed a program, you're then able to monitor your patient's progress. So, your dashboard will give you a list of all the different patients that you've prescribed to and what program they're doing and where they're at in terms of actually completing the program. Now, on the other side here, you can see that there's an individual patient and how they're doing in terms of their scores on the measures to look at, pain impact, to look at pain self-confidence, self-efficacy, and also fear avoidance. So you can see whether or not that's changing over time. You can also see which lesson your patient is up to. One of the things that some patients, depending on what reasons they have, it might be that they are, wanting the doctor, for example, to prescribe an increase in their medications. And so they might say, oh, yes, I've done the program, I've done them all. You can actually see whether or not they have, which can be good. And sometimes, patients might do 1 or 2 lessons and go, oh, no, I completed it all. And so you actually are able to see what they've done, what they've not done. It's not to, be punitive. It's just so that and you've got a record of, what the patient should understand at that point, what perhaps, they haven't learnt yet if they're only up to, say, lesson 2. So you can help them to keep moving forward. In addition, with the psychometric measures that we take, it also will send you an email message should your patient score particularly high. It also sends them some details of, emergency contacts, people that they can contact if they're feeling distressed. So that's quite good in terms of, being alerted if something significant has changed for your patients. For a lot of persistent pain patients, they will score quite high on some of these measures. But, because your patients quite well, you generally know if, there's something different than what you've seen previously. So that can be quite helpful. So the patients get, they do the lessons, and then at the end, they also get a lesson summary and a bit of a plan then for what to do next. So, looking at what goals they're setting, looking at, what they need to do for that particular fortnight. Do they need to do some different relaxation? Do they need to look at movement? That sort of thing. And there's also links for them to those video resources so that they can use them at any time. And for clinicians, the added bonus of, having some resources for clinicians to actually, help find extra ways to integrate the program into care, training manuals, information for you so that you also know what your patient is, what information they're getting, what they're learning. And that is just a lovely QR code to be able to access the program as well, or the website. And that's some selected references. So any questions?
I think there's one question that I can see just in the webinar chat.
Mm-hmm.
Around medication. So from Katrina is asking, do you think certain medications are indicated for acute or chronic flare-ups? And should GPs consider this for short-term treatment to enable the patient to continue to mobilise?
Well, the first thing I'll mention is, I'm a psychologist, not a doctor, so take what I say with a grain of salt when it comes to medical advice. Unfortunately, it's an individual thing. So there are certain medications that are given when somebody's having an acute, if they're having an acute injury and they've got chronic pain, that's one thing. If they're having a flare of their chronic pain, the advice usually is, look, people can change the way that they, either take their medications slightly if they've been given that advice by their doctor. By and large, we sort of say, look, if you don't need to be taking extra medications, it's best not to. Depending on, like I said, individual circumstances, but quite often flare-up management is usually around perhaps dialing back a little bit on what you're doing, but not stopping completely, using other strategies to manage in the meantime. It might be getting some extra assistance, dropping down whatever activity levels you've got, just a little bit, taking a lot of extra breaks, things like that. But definitely, it's an individual thing because, it depends on what's actually happening for that patient at the time. If there's something that is, say, a new inflammatory condition, then, anti-inflammatory type medications may be indicated. Quite often with chronic pain patients, if it's them just going, oh, I think this is what's going on, when they have a flare-up in pain, they will quite often say, I think I've got inflammation, where it's actually, no, it's not necessarily inflammation. So once again, it depends. Yeah.
Thanks, Jane.
Mm-hmm.
I can perhaps, if there might be some other questions coming through, I'd be happy to speak a little bit more just to some of the, I guess, practicals around This Way Up if people listening are interested to refer or to prescribe the chronic pain program or some of the other programs to your patients that you're supporting. There was a question earlier around can registered nurses refer and prescribe to the This Way Up program? And the answer is definitely yes. So you don't have to be a doctor, a psychologist, or any specific health professional to use the This Way Up programs. The role of the clinician, I mean, it's wonderful if that is your area of expertise, but I guess the self-guided programs are designed so that your main role is to be the clinician providing that support and motivation and sort of supervisory oversight of the intervention, rather than having to actually deliver the specific cognitive and behavioural skills. So any health professional that is involved in a patient's care is very welcome and able to prescribe programs. I'm just seeing another question come in now. This is from Monica. How would you suggest a pharmacist recommend a patient talk to their GP about this program? I think that's a great question.
Yeah, it is. I'd just be direct and down the line. If it were me, I'd just be saying to the patient, hey, look, there are some options out there. One of them is, the This Way Up program. It'd be really great if you had a chat to your GP about it because, they might be able to then prescribe it for you and, it will help them and help you to actually get the best out of your pain management. We also, I'm not sure, Katie, whether they're still available, but we did used to have some postcards available.
I was just going to say that, yeah.
Yeah,
if and so you could simply, we've done that before.
Yeah, because then the postcard, you can just literally just give it to the patient and say, hey, look, this is, another option, hand it to your GP.
Yeah, I think that's a great idea, even just having, if it's of interest. We've got, some little postcards that just have directly the QR code to the This Way Up website. We should be welcome to share. If people are interested, let us know, and This Way Up's happy to send those out. And I guess very briefly on that note as well, Jane was already sort of explaining how that prescription process works, you know, with the patient's consent. You pop in just their name and email address, and you can click waive the fee. So there's no cost at all to the patient. I know that This Way Up has also done some work with the Western New South Wales PHN before, and we actually have a voucher code for people who might be looking to access one of these programs, but you may not be supervising them or prescribing the program. So we can also share that voucher code, which will provide free access. Sorry, I'm jumping all over the place, but I've just seen another question pop up. Okay, so this question is from Ashraf. What recommendations for management of multiple grief in the chronicity of pain? So I guess it sounds like around the comorbidity of perhaps grief and chronic pain. It's a really interesting question.
That is a really interesting question. And I'm trying to think what, usually it's because it's quite difficult, because I've done quite a bit of grief work lately as it happens, just because, it's been the, obviously when, if somebody dies, that can become the dominant thing that's then going on. But of course, it can also then be driving increased pain. So what I would generally do as my approach is I'd actually be working more on the grief. Now, if we're looking at sort of somebody who's, who's died, very soon, I don't start a lot of really intensive grief work, because you can actually traumatize the person. But instead, it's getting them to, you're normalizing their emotions and their responses, and actually, saying to them, look, it's okay to have a mixture of emotions, to have lots of things going on, that you might not be feeling anything much about it, you might be feeling a lot. But also to just, briefly acknowledge how that can actually also all be affecting your pain, that you might notice that, your pain is worse when you're feeling really distressed, because of course, that can be one of the ways that our system can tell us that there's, it's got concerns. So you're just normalizing that experience for the patient. When it comes to grief around other things like, having pain and having to accept pain, that's where the online programs can actually be quite good at helping people to understand that, pain is complex, that it can be really upsetting, that we can't do things the way that we used to, or, that our role has changed in, our life, that we're no longer the person that we thought that we were, in terms of, oh, I was the provider, or I was this, that, and the other. So, pain programs themselves can be quite helpful in that regard.
Thanks, Jane. It's very helpful. I can't think of anything that I would add to that. It's very individualized. I think there are some really wonderful suggestions.
And look, I think the additional thing is you can also look at some of the problems that are happening as a result. So, for example, if people are starting to have some sleep issues as a result, you can actually then say to them, hey, you can, This Way Up also actually has a sleep program. So, if you're having problems with insomnia, great, they, that can give them something then that's very practical that they can work on. By the way, they did some research on which was a more effective online treatment program, the anxiety program or the sleep program. For people who had anxiety, was it, anxiety and sleep problems, which program should they do? And actually they found that the sleep program was more effective for both sleep and also then helping anxiety than the anxiety program was at helping with anxiety. So if you do have patients with anxiety problems and sleep problems, perhaps get them to do the sleep program, because it sounds like that from what I read with the research, it was really, really quite effective. So, which makes sense.
Yeah, and the good news about that is the sleep program is a little bit quicker too. So
also true.
That means people can be feeling better sooner than, we of course want to support that.
Yeah.
Just another thought that has popped into my head to let people know about is another option that's available through the This Way Up website. It's an online anonymous assessment tool. So if you are working with patients that you're sort of questioning, perhaps is there primary need here around some treatment of pain issues, or is it more that they insomnia is the primary concern, or depression? It's an online self-report assessment tool that will provide recommendations to people based on their sort of self-report of their own symptoms. So that can sometimes be helpful too.
Mm. And look, I think these programs are great just in terms of, how they can be used as an additional part of a person's treatment plan, whether that's pain or something else. I mean, I know, for example, that a lot of psychologists who don't have experience in pain management feel quite overwhelmed when they have a patient who does have pain, because the patient is often telling them, oh, but if I didn't have pain, I wouldn't be depressed, or if I didn't have pain, I wouldn't be anxious. And so the psychologist starts to feel like, oh my goodness, they need to deal with the pain and then I can see them. But it's actually, no. They'll need to be working on those things too, because it's not that straightforward that if this was gone, everything would be sunshine and roses. But it means that the clinician can then get support of knowing that the patient is working on, managing their pain from that, cognitive behavioural perspective, while they're then able to do some additional work on some of the mood-related aspects. And same is true of, say physiotherapists who then want additional support with the psychological components. So, these things can work together. It doesn't have to be that, it's just one clinician and then, the program. It can be that the GP's involved, there's a physio involved, and the program, or, any combination that's going to work for the patient or that's available.
Thanks, Jane.
Mm-hmm.
Any other, I have no other questions yet at this stage coming through. And just to let you know, Judith, I have received your message, so we'll follow up on that with the cards. Thank you.
Well, thank you, Jane and Katie.
I think
it was
might have just
wonderful presentation. Sorry, another question? Yeah.
Sorry, there's just one question that's come through. And this person's asking, is it free to join up to prescribe the program for allied health? Yes, I should have mentioned that. So there's no cost at all to create a clinician account, to register as a clinician, no cost involved. And all of the treatment programs, whether it's chronic pain or any of the others, are free to any patient as well when it's clinician supervised. For some of them, there's a small fee when it's not clinician supervised. But again, if we don't want that to be a barrier for anyone trying to access these treatments. So that the voucher code we're very happy to share. It's WESTWELL, all capitalized. So WESTWELL. We'll type that in too.
Mm-hmm.
We can follow up again with that written down for people that may need it later.
Yep. And I will just mention, I probably should have updated my bio. It's been a while. But I've also been working for the long COVID service at St Vincent's. And we know that patients who are experiencing long COVID, who have persistent pain, tend to have increases in their pain, as well as some people with long COVID starting to experience pain. So if people are, needing anything specific around long COVID, please feel free to actually send me an email and I'd be happy to supply you with some resources, more than happy to, because I think it's one of those things, it's a new area. A lot of people aren't sure what to do. So if there's something that you need, contact me.
Thanks, Jane. And likewise, in my role at This Way Up, I can provide some clinician-to-clinician support. So if any other questions come up after the webinar or further down the track, you're very welcome to reach out to the This Way Up team, and they'll put you in touch with myself or one of my colleagues.
And I'll share the slides probably tomorrow for everybody that participated tonight. Thank you. I've just got the evaluation up now, if you wouldn't mind filling that in. Jane and Katie, thank you again. It was
You're very welcome.
Such an interesting presentation.
No problem. Thanks.
Appreciate your time. I'll just leave the code up for a bit while people are doing that. And but thanks everyone for joining us.